integrative medicine. I don't know if many of you know what integrative medicine is. If you're like me, about 10 years ago, a doctor friend of mine asked me what integrative medicine was, and I had no idea. I had never heard of the word. So I asked him what it was, and like a good teacher, he said, if you're interested, you look it up. Here says I am. I looked it up, and I realized it was the kind of medicine that we should all be practicing in the United States. It's very patient-centered. So integrative medicine is the practice of medicine where patient and practitioner partner up to look for processes of healing. All factors that influence health, wellness, as well as disease is taken into account, especially addressing the mind, body, and the soul. We look at the entire person as an entirety, not just a specific area of the person. We use conventional as well as complementary medicines. We use natural, less invasive medications and less invasive procedures when possible. And it's a science-based medicine. That's very, very important. By the end of the 1980s, early 1990s, there was a big interest in complementary alternative medicine. So Congress asked the NIH to investigate this complementary alternative medicine to find out if in fact it was real or if it was quackery. So in 1992, the National Institute of Health opened up the National Center for Complementary and Alternative Medicine. And what they had to do was figure out what this alternative medicine was. They did research, investigations, they found whatever was out there, so they analyzed it. At that time, in 1992, NIH thought that integrative medicine was a combination of mainstream medical therapies and complementary alternative medicine for which there is some high-quality scientific evidence of safety and effectiveness.
Sorry,
Alternative medicine.
Can you put it in projection? Like, yeah, presentation mode? So
I can speak up.
Can you maybe use the microphone, please?
Yeah. In 1992, they also said that alternative medicine was treatment that was used in place of standard medical therapy. And as an example that the NIH gave was the treatment of heart disease with chelation therapy. Chelation therapy is the use of an intravenous substance, usually high-dose vitamins, to get rid of all the metals from the arteries, and that was sort of used as alternative medicine as opposed to angioplasty and the other types of medical therapy that was standardized at the time. This is the NIH definition back in 1992 as for alternative medicine. So for the next 25 years, again, they did the research, the studies, they gave money to do studies, and they realized that in fact, integrative complementary medicine had benefit and use in medical healing. This is different than alternative medicine. Alternative medicine are those people that you hear about that do colonics or they do IV high doses in some Holiday Inn someplace. It's used instead of evidence-based medicine. That's alternative. So because of that, in 2014, the NIH changed the name of the National Center in Complementary Alternative Medicine to the National Center for Complementary and Integrative Health, reflecting the fact that indeed integrative medicine, complementary medicine, does help patients in obtaining healing. And just like the name says, integrative medicine, it integrates medicines from around the world that have some established basis in science. So we use Western medicine, what we learn in medical schools here in the United States, what everybody teaches, what everybody practices in the United States. But we also take medicine like Ayurvedic medicine, which has been around for 2,500, 3,000 years. This is from India. We use traditional Chinese medicine. It's been around for 2,500 years. These medicines or modalities are still used all across the world to this day. They have a lot of benefit to it. We also acknowledge chiropractic, naturopathic, and any other type of medical type of system that has been shown to work and that is not dangerous. We incorporate it, and that's how we get the name integrative complementary medicine. So from Ayurvedic, which is Indian medicine, we have yoga, meditation, plant-based oils, aromatherapy, herbs, massage therapy, nutrition, and breathing yoga. Traditional Chinese medicine, we have acupuncture, cupping, tai chi, qigong, balance and stress control, the yin and the yang, duality. All of this is important, and many people still practice this here in the United States. I am a cardiologist. I am an integrative medicine, functional medicine, certified in everything. And when I get patients in my office with palpitations, 40% of my practice have emotional issues. They're not really cardiac. They've gone to see cardiologists, they've had stress tests, echocardiograms, they're put on a wide variety of medications, including Valium and Xanax. You have a good patient history, you analyze them, and you realize that it's stress, it's anxiety. So something that I teach them is breathing exercises. So if you're ever like stressed out, if you ever feel like very anxious, I invite you to take in a deep breath, slowly for a count of 4, hold it for a count of 7, and then breathe breathe out slowly for a count of 8. So try that. Let's all breathe in slowly for a count of 4. Now hold that for a mental count of 7. And you're going to exhale really slow, mental count of 8. You repeat that like 2 or 3 times, you're going to find that you're going to be more relaxed. That stimulates the parasympathetic nervous system, which is the brake of your body, different to the sympathetic nervous system, which is the fight or flight. So just learning that breathing technique, I can take people off medications, which is one of the goals of integrative complementary medicine. People are over-medicated in the United States, so it's our job to take away medicines that they don't need. Similar to integrative medicine, functional medicine. Functional medicine, individualized, patient-centered, science-based, empowering patients and practitioners to work together to find the underlying cause of disease. It requires an understanding of each patient's genetic, biomedical or biochemical, and lifestyle factors to direct personalized treatments. It addresses root cause. This is something that is not taught in medical schools today. I know because I teach in two medical schools. Right? We teach there's a pill for the ill. What is the outcome? What is the disease? What pill can I give? What diagnostic test can I do? Functional integrative medicine, we go back. How did it start? What is the root cause? And what can I do to maybe take people off and address the underlying individual cause that led up to the current disease state? This is one of the history-taking charts that we use in integrative and functional medicine. We have antecedents, predisposing factors, genetics. We go back. Were you a cesarean section delivery? Were you a vaginal delivery? Were you a 9-month gestation? Were you like born 3 or 4 months before? Was it a traumatic childbirth? Did you get antibiotics when you were a kid? Where did you live? How was the family structure? All of those things that occurred when you were developing impact disease development decades later. We now know that. What are any triggering events? Did you get divorced? Was there a separation, a death in the family? That can also impact health and wellness. Any perpetrators or perpetuators or mediators, anything that continues to exist within your life that continues to produce those symptoms. And most importantly, we address modifiable personal lifestyle factors. Sleep and relaxation. How about exercise and movement? How's your stress level? How is your relationships? Are you by yourself? Are you in a loving relationship? Are you divorced? Is there any issues? And most importantly, nutrition. All of these things we can modify. Sometimes when we are born with genes, we can't do anything about it. But just because you're born with a gene that might develop a cancer or Alzheimer's, like the ApoE4, does not necessarily mean that you will develop that disease. It can be modified through epigenetics. And this is what we are learning now in integrative and complementary medicine, just like the speaker before me had mentioned. This I took from Duke University, because there's major universities that have departments of integrative and complementary medicine, just like Sylvester at the University of Miami. So in the middle of this graph, mindfulness. What is your perception of your disease? How do you interpret it? What do you do with it? Movement and exercise, again, nutrition, physical environment, relationships, personal growth and spirituality, mind and body connection. This has to be a part of a physical examination and history for each individual patient. It's very important. Integrative functional medicine is holistic medicine. We treat the entire patient, from the tip of your head to the toe, to the bottom of your toes. We want to find everything out because every system is part of you and impacts the disease manifestation, or it can help wellness. So people have asked me, when do I think integrative medicine or complementary medicine started in the United States? There's really no answer. Nobody really knows. But at the end of the 1990s, there were 2 Michigan brothers who advocated nutrition and lifestyle as the foundation of health. They also developed the flake grain cereal. They advocated alternative treatments, which were diets low in fat and animal protein. They advocated the consumption of yogurt, nuts, whole grains, fermented foods, which are prebiotics, fiber-rich foods, probiotics or fermented foods, and prebiotics are fiber-rich foods. Much of what we now recommend our patients to eat. They also emphasize the importance of fresh air, exercise, hygiene, including yogurt enemas. They loved their yogurt. And they ran sanatoriums, which were health spas. They were also a proponent of whole foods. Now, I bet you that the majority of you have heard of their names, and many of you have eaten their cereal, because it was the Kellogg brothers, and the product was Kellogg's Corn Flakes. 1892, Battle Creek, Michigan. So you could say that they were way ahead of their time. Current modern medicine, 1910, issuance of something called the Flexner Report, where they did a study of the medical schools here in the United States, and they found out that basically anybody who had money could become a doctor. There was no criteria, no curriculum. It wasn't science-based. So that changed everything. At the beginning of the 20th century, medical schools had to have a curriculum. They were science-based. We had the refinement of the microscope. We were able to detect microbes, bacteria. Then we had World War II, development of antibiotics, subatomic particles, and atoms. There was technologies that we could identify smaller parts of the whole, particles and things that we couldn't see with our naked eye. That fell along with the reductionism theory of René Descartes, who said that complex phenomena can be understood by reducing them into smaller constitutional parts. And that's the way we practice medicine today in the United States. It's a series of reductionism. Instead of seeing the patient as a whole individual, we break it down into different body parts. And that's what we teach today. So we went from the country doctor who took care of babies, delivered babies, pediatrics, adults, old people, did some surgery, to the area of specialization. So now we have cardiology, neurology, gastroenterology, infectious disease, endocrine, dermatology, and so on and so on. We even have subspecialties. We have electrophysiologists. We have doctors who only do angioplasties. We have hematologists that only work on blood cancers. We have surgeons who only do neurosurgery. So subspecialization and specialization came from the reductionist philosophy of the early 1900s. So what happens is that our healthcare here is fractionated. We become a country of specialists. We're all focused on a specific body part, and we fail to see the patient as a whole. We start treating ailments as opposed to patients. We love technology and medicine. We love our one-size-fits-all, guideline-based, checklist approach to the practice of medical care. We treat the 90-year-old, 100-pound little old lady with the same medication, same doses that we do a 400-pound linebacker. It's become more like disease management than healthcare. As a result, the United States is the only country in the world where maternal mortality has consistently increased over the last decade. That should be a canary in the coal mine. That is frightening. There's 2 other countries in the world that has worse statistics, and they're both in sub-Saharan Africa. We're number 11 of industrialized nation in terms of healthcare outcome, while we are the most expensive. And we're number 34 in the world, according to the World Health Organization, in quality and cost, 2 places ahead of communist Cuba. In 2016, we spent $3.3 trillion, or $10,000 per capita, which is 18% of the United States economy. That's for Centers for Medicaid Services, double that of the next nearest country. So that's why integrative functional medicine is 21st century medicine. Treats the entire person individually, mind, body, and spirit. We personalize care. We use genomics. We use disease modulating therapies, epigenetics, stress control, community, sleep, exercise, movement, and nutrition is the foundation of maintaining and achieving wellness. It's not just drugs. There was Socrates, 460 BC, 2,500 years ago. Let food be thy medicine and medicine be thy food. One of the definitions of a medicine is something that it's ingested or when it's absorbed into the body, it has the capability of altering the function, the molecules, the physiology of the body. Food is that, and we consume it 3 times a day. That's why we have an epidemic of obesity, chronic diseases, because we start giving our kids diet soda and sodas when they're children. By the time to be 20 or 30 years old, they've already been developing all of these chronic processes from an early age. So how does integrative medicine work with gastrointestinal stromal tumors? We work as part of the team with your primary care physicians, oncologists, hematologists, gastroenterologists, and other caregivers. There's a lot of post-surgical symptoms related to chemotherapy, radiation, maybe emotional issues like depression or anxiety. We know that Gleevec is often used in many patients. It has a lot of side effects, from GI side effects, diarrhea, nausea, to muscle aches, headaches, GI blood loss, even left ventricular dysfunction in 5% of the people. It's metabolized in the liver. And there's certain supplements and things that you might be consuming that has the capacity to affect the function of Gleevec. St. John worts decreases Gleevec activity. Grapefruit juice, many people might take it, increases blood levels of Gleevec, as well as warfarin, metoprolol, simvastatin, and others. That's why it's really, really important if you're taking supplements or juices of any kind that you let your medical oncologist know, because these have a way of impacting the effectiveness of medication. So again, integrative medicine, complementary medicine, mindfulness, meditation, journaling, relationship, gratitude, community. The Life Raft group is a great example of community, like-minded individuals going through similar situations that you're there for support. All right? You can't live in isolation. That's not very good. We need to get people moving as much as you can. Walking, biking, rowing, Tai Chi, low-impact exercises, yoga. Sleep is very important. Aromatherapy, visualization, try to find out why the patient isn't sleeping. Again, examples, high blood pressure in patients on 5 medications. We give more drugs, more drugs, more drugs. Nobody ever bothers to find out, well, what time do you go to bed? What's the quality of your sleep? Do you fall asleep during the daytime? Do you snore? Do you have sleep apnea? Are you drinking? How's work? Any situation at home? A lot of times these environmental factors can contribute to the end result, which in this case is high blood pressure. So we need to address the underlying factors that may be causing the end result or the problem, and not just medicating the problem. The GI tract. We know that a lot of people who have GI and GIST tumors have problems with absorption. So there's different modalities, different types of food, different types of feeding regimens that we can provide help with to see if they can increase their appetite. We need to protect the microbiome. Microbiome is the good bacteria that we have in our guts. They are individualized. Everybody's microbiome, or the bacteria that you have in your gastrointestinal tract, is unique to you. It's like your fingerprint. We know that certain medications like omeprazoles, the Nexium, the acid reflux medicine will kill all those good bacteria. That's why we recommend probiotics. Prebiotics are certain types of food that feed the good bacteria, the probiotics. So we need to help people maintain their gastrointestinal tract. The effect of the microbiome in cancer, it's incredible. A lot of research is being done. These are just some of the articles from Carcinogenesis, National Review of Cancer, where they're implicating a connection between the microbiome, which is the good bacteria, with the development of cancers. This is from the scientist, and that's what your microbiome looks like with some pathologic bacteria. But the microbiome isn't just for cancers. It also has to do with liver disease, and it also has to do with atherosclerosis or heart disease. So we're learning more about the good bacteria in our gut, and that's what integrative medicine, complementary medicine does. We're not limited to one specific organ, one specific body, because the patient isn't one specific organ or one specific body. Patients are in total. As you can see here as well from the National Institute of Health, they have studies going on. Mediterranean diet may slow Alzheimer's disease, Epstein-Barr virus and autoimmune disease. Stresses can impact long-term health. So this is being recognized more frequently, the impact of your lifestyle in the development of disease progression or in curtailing it. So you probably forgot when I first started the talk, I said that alternative medicine, the definition by the NIH in 1992, was the treatment used in place of standardized medical care. And the example they gave is treating heart disease with chelation therapy. This is an article from the Journal of the American Medical Association, 2013. They're using chelation therapy in patients who have had myocardial infarctions, and they are finding a 50% decrease in morbidity and mortality in patients who are male diabetics. So what was old at one time may be coming back. You just have to have an open mind and make sure that the source of your information is sound and solid. Just another quick thing, I had a patient of mine who had like this mole on his back for like 4 years. It never bothered him. He felt great and felt wonderful, but at the insistence of his wife, he went to the dermatologist reluctantly. So they biopsied it. 4 days later, 5 days later, they get a call that it was a malignant melanoma. And the dermatologist said, you know, I'm so sorry, it's not good. We need for you to go today to go to the university-affiliated cancer institute. It has to be taken care of. So he was in shock. He was floored. He felt great. There was nothing going on. So he went. And he registered. They put the little name band thing on him. He filled all the forms and everything. But he was so freaked out that he forgot that he had insurance. So he paid with the office visit with a credit card. Then he went to the appointment. The nurse took him in, thermometer, blood pressure. They weighed him. Standard questions: were you ever supposed to son? How many kids do you have? Are you married? They gave him a gown, went to see the oncologist specialist, So he dressed, they gave him one of these like robes so that your butt is like all open in the back. And it was very cold, he said. So then he waited, and about 5 minutes later, the specialist comes in with like 4 medical students. So then he really felt, wow, you know, I'm being evaluated by like, you know, 5 people now. And not only that, they all had like little magnifying glasses. So there were like 5 sets of, you know, eyes just like peering at him all over the place, looking for lesions. And then they found one on his skin. So they asked him if he had a cell phone, and the specialist took a picture of it and gave it to the patient. You know, here's a reminder, here's a souvenir of your cancer, here's another one. So they evaluated him, and then he got dressed, he left, and just as he was leaving, he was like so freaked out. I mean, remember, this guy had never been sick or anything. He found himself asking them, well, how long do I have to live? Thinking that the reply was going to be, yeah, don't worry about it, there's a lot of good treatment options right now, you'll be fine. They said, well, it depends on the metastasis and the depth of the lesion. Good luck. What? It depends on the mitosis count and good luck. What? That's not what I was expecting. So they took him back downstairs. He paid again, credit card, to go see the surgeon this time. So this has been like 3 hours. So when he gets to the surgeon office, there was a dermatology resident. And the dermatology resident introduced herself. She looked at the chart quickly and said, oh, my dad had what you had, and he's gonna have the same thing that you had. So for the first time, we felt, wow, okay, cool, you know, maybe there is something. So then the surgeon guy comes in, looks at the chart, says hi, then asks the dermatologist, what stage is he in? And the dermatologist resident said, stage 1. He said, no, stage 4, highly mitotic. It's penetrated like 5 millimeters. So they kept on talking, and then he turns to me, and he asked me what I did for a living, because that patient is me. And that was the first time that anybody had asked me what I did for a living, because I normally don't sign MD on my name, and I never put physician or doctor, because that day I was a cancer patient. So they felt kind of bad. They sent me home. I came back. I had my surgery. But then when I got home, I asked why. Why me? Why? And then why is the worst question anybody can ask when you're confronted with a situation that doesn't look hopeful, because your brain has a way of coming up with reasons that have no sense in reality, and it brings you down, makes you more depressed. So after I ask myself why 2 or 3 times, it's like, well, wait, why not? Who am I to think that I'm special? So I remembered what I learned in my first year of my integrative medicine residency, which was the body has an innate ability to heal itself. I emailed all my friends, back to people from work and everything. This is what they told me I have. Not this is what I got. This is what they tell me I have. So if you ever want to find out how I'm feeling, how I'm doing, never mention the word malignant. Never. Just say, how are you feeling? How are you doing? I gave thanks. I'm healthy. I feel great. They caught it in time. The body has an innate ability to heal itself. That was 4.5 years ago. I never needed anything else. So I think for me, remembering those integrative medicine teachings changed my diet, stopped drinking so much diet soda. Here I am today as part of you. So I hope that this was helpful. If you're going to read, please go home and Google integrative medicine, functional medicine. There's a 9-month waiting list at Cleveland Clinic to try to get into functional medicine. This is the future of medicine in the United States, because it's individualized, it's personalized, and we take you in your entirety. Thank you.